So Durham Connects does three things. First of all, we try to connect with every newborn in the community. This is universal. This is public health population. At 1 hour after birth, invite ourselves into the home for 3 to 7 contacts, right? Home visits by a public health nurse, in which we frame the parenting task as important, and we communicate that this baby's a positive in their lives and in Durham's lives, and to celebrate rather than a pain and a burden. And try to communicate that and intervene. We assess their needs. Families' needs are very different. Some are substance abuse, domestic violence, some parenting, some where is simply the best child care service available, etc. We connect them to community resources to meet those needs so that they in turn can connect with their baby. That's the goal of it. It's cheap, $600 a family. We surround them with an umbrella of community resources. We evaluate it with a random controlled trial, right? So we randomly assign every Durham resident birth over 18 months to intervention or control. This was by even or odd birth date. If you were born on an even birth date, you're in the intervention group. If you're born on an odd birth date, you're in the control group. That way we can use administrative records to evaluate outcomes with never having bothered that control group or families at all. Right? So that was 4,777 births. We implement the intervention. We did it with pretty good fidelity. About 80% of all births in Durham agreed to participate. 86% of agreeing parents completed the program. Checked fidelity to our intervention protocol. It was pretty good. We took a small subsample and condition blind and interviewed them at 6 months of age. And then we also use administrative record review, right, to evaluate outcomes. We replicated it in a second RCT, also in Durham, as well as in a field quasi-experiment with 4 communities in eastern North Carolina. And lo and behold, what did we find? Random assignment to the Durham Connects intervention for mothers reduces emergency medical care episodes. Not only is reported by the mothers, but actually is gotten from the administrative records from Duke Hospital and Duke Regional Hospitals, right? So these are the official records across the first 12 years of life. You can see a nice bump difference between the control and Durham Connects families right at 1 month of age when we're intervening, but then we leave, we're out of the family in the first several months. This is not a long-term ongoing program, right? We're long gone, and the 2 lines continue to diverge so that the effect was larger. So there's a real preventive effect, right? Cost-benefit analysis shows a pretty good savings to Medicaid. I won't talk about it anymore. Last empirical slide. When we go to child abuse registry records, these are the official state records, who's investigated for child abuse and who's not. We find a 36% reduction in 48 months. So I think we're preventing child abuse in these families. Right? Let's see, we're continuing to follow them up. All right, we're disseminating. We go outside of Durham, we can't call it Durham Connects anymore, so we call it Family Connects. So we're disseminating Family Connects nationwide now. The blue circles are where it's actually being implemented in North Carolina, Iowa, Minnesota. The yellow dots are where we're planning to begin to implement it in other states across the nation. So we're part of all of that effort. And that's a real public health research enterprise because we're trying to study that process in all of those places.